More than 150 flights have been grounded and thousands of passengers stranded after a COVID outbreak amongst air traffic controllers at Gatwick Airport. With nearly a third of their staff unwell, the disruption's expected to last all week and affect all airlines. Bad news for travellers. Joining me now, independent travel editor Simon Calder and GP Dr. Philippa Kay. Good afternoon to you both. Let's start with Simon. He can fill us in on the sheer scale of this. So this is all in the air traffic control tower at Gatwick, where they're going down like flies and ninepins with COVID, for goodness sake.
Well, there's a great deal of upset and concern among the, I estimate, 25,000 passengers who, between now and Sunday, will suddenly find their flight is cancelled. And if I may, just before we get on to the causes, if your flight is cancelled, then the airline has an obligation to get you to your destination as soon as it can on the same day, if that is possible. And I've already heard from one person whose flight to Barcelona tomorrow was grounded, and he was offered a connecting flight on Friday. I told him that actually there were loads of flights to Barcelona on, for example, British Airways from Heathrow, and all they needed to do was book that for him. But it's an absolute mess. I've never seen anything like this. We've had last summer, you might recall, when things weren't going brilliantly well with aviation, we had the situation of both Heathrow and Gatwick imposing a cap on movements simply because they didn't have the staff overall. But now we are talking about a few dozen staff, an outbreak of COVID, and it is ending up in misery for travellers, and the airlines who are ultimately having to foot the bill for this are furious as well, as is Gatwick Airport, because at the moment it doesn't look like an especially resilient place, although they do assure me things are going to get better. But those poor air traffic controllers, 30% of them off sick, bout of COVID going through, and crucially, of course, air traffic controllers have to be at the absolute peak of their game all the time, especially when they're looking after the world's busiest runway, which Gatwick's normally is.
We've been told it's going to get worse, not better, and Friday's going to be the worst day, and it's only Tuesday today. Why are they all suddenly going to be ill on Friday?
No, what they're doing, there are going to be a lot of cancellations on Friday, more than any other day. But that's actually only because in order to get the numbers down to 800 movements a day, you've got to cancel, I think, on Friday about 60 flights just to make it manageable with the staff they believe they will have available. And then from next week, two things happen. Hopefully people get better, although we will hear from your excellent medical guest. And also the number of flights reduces because we're getting into October and people are flying less.
Dr. Philippa, so, you know, everybody in the air traffic control tower at Gatwick, some are feeling pretty ropey, some have had to go home, and it's COVID all over again. And just talking about it to you seems to plunge me back into 2020 and 2021 in a way I'm not at all comfortable going. So tell me that it's not something we have to worry ferociously about. Tell me it's not that horrible new strain, and if it is, it's not as serious as the old one. What can you tell us that isn't frightening?
Well, I wish I could tell you all was positive, but we are heading into the winter, and winter is difficult, and COVID hasn't gone away. Now, we don't know if this is the new strain, Pirola, or not, but I think one of the reasons that we sort of might also be able to predict how long people won't be there for is that there is still guidance. If you do test positive, if you pay for a test, or if you have tests at home that aren't expired, if you're under 18, we recommend that you stay at home for 3 days. If you're over 18, for 5 days, to try and prevent spreading it. And that if you have somebody in your close family or friends or whoever who are immunosuppressed, that you avoid going near them for 10 days. So although it isn't law like it was, in the same way if you had chickenpox, you wouldn't send your children to school and you wouldn't go out. We are asking people to still follow those rules. But the reason that I don't think it is all doom and gloom is that we are not in the same position as we were in 2020, in that we have treatments now. We have a vaccine now. The autumn booster program for flu and COVID is in full flow. So if you are eligible, please go and get one.
And if you're eligible, you have to be what? You have to be over 65 or have an underlying health condition. Is that it?
or be a resident in a nursing or residential care home, or be a frontline health or social care worker. And if you aren't sure, when you go to the NHS website or you phone 119, they'll ask you the relevant questions and tell you whether or not that's something that you are eligible for. Unlike the flu vaccine, where you can pay for that privately in a pharmacy or somewhere else, you can't do that as yet for COVID. But if you are eligible, please have it. But if you do have COVID, we are still asking people to have that civic duty and to stop the spread to others by staying at home.